Have a bit of a peek in Lucy's ears there. If you might actually just sort of sitting her down with her legs facing this direction there. Hello. If you grab, just give her a bit of a cuddle, bring your head up against yourself, and put your hand over that side. That's good. Yep. Have a wee peek in your ear there, sweetie. You see my little torch? It's like that. A little tickle of your ear. Here we go now. So I've got my finger braced up against her cheek there, so in case she moves too much. We can actually see, and that's a very nice looking eardrum there. So if you switch around the other way, she's facing this direction this time.
When testing infants who are too young for play audiometry, a different approach is needed to obtain behavioural responses to sound, visual reinforcement audiometry, or VRA.
Okay, so now we're going to set up and do the VRA test. We're going to be basically playing a series of beeps through the speaker over there to her. And whenever she turns towards some of the sounds that we play, a little puppet's going to light up and do a little dance for her. It's really quite fun. And that should encourage her to turn towards sounds every time she hears them. So if we're pairing the sounds together with the stimulus, that'll reinforce her to turn towards those sounds there. In order to do this properly, though, we've got to have her sitting in the right spot in the space here. Otherwise, the sound level won't be quite right for her. So we need to set her right at the top of the little X there. That's perfect, yeah. In fact, actually, let's get this shuffled back a little bit. I'm just going to start with a very quiet, sparkly little toy here.
Two audiologists work together during VRA testing. The distractor stays in the room with the child, ensuring that their attention and eye gaze are held directly in front.
Good work. You're a very good listener today. So.
The second audiologist, the tester, is often outside the room, observing through a one-way mirror.
Yeah. Good listening. Good work. It's like clockwork, aren't you?
The two audiologists communicate via a radio link.
Magic. Nice.
Together, they judge a child's response to sounds presented either free-field, via loudspeakers,
Good girl.
or via headphones or earphones to gain ear-specific information. Sometimes very young babies need to be seen over multiple visits to build up as complete a picture of their hearing as possible.
Okay, good idea. Yeah, good.
It generally depends on the baby.
Good girl, well done.